check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program. In this video, the term assistant refers to extra staff members required to help position the patient safely. Any member of the nursing team can provide this assistance. To position a patient in bed, first decide if you will need help and arrange for extra help as needed. If the patient can assist partially, encourage him to do so. Based on the nurse's instructions or the care plan, position the patient. For example, with the patient supine, raise the head of the bed 30 to 45 degrees for the semi-Fowler's position, or 45 to 60 degrees for the Fowler's position.
There you go.
If his upper body is immobilized, use pillows to support his arms and hands. If needed, place a pillow at his lower back. Put a small pillow or roll under his lower thigh, elevating the knee, and place a small pillow or roll under his ankles. To keep the patient's feet properly aligned, use pillows or other devices to maintain proper positioning of his feet. If you need to move the patient into a side-lying position, first lower the head of the bed as flat as he can tolerate and move the pillow near the headboard.
I'm going to take your pillow from you. I'll give it right back. Move the covers out of the way. He's going to shift to his left.
Position the patient supine on the side of the bed opposite the direction to which he will be turned. Standing on the side of the bed to which he will be turned, bend the patient's knee opposite from the direction of the turn. Place one hand on his hip and one on his shoulder, and roll the patient toward you onto his side. Put the pillow back under his head and neck. Support the patient by placing a folded pillow or a wedge behind his back. Bring his right shoulder blade and hip forward so that the angle between the hip and the mattress is about 30 degrees. Place a pillow under his semi-flexed upper leg. If required, place a sandbag parallel to the sole of the dependent foot. If you need to log roll a patient to maintain neck and spinal alignment, obtain the help of at least 2 additional staff members.
Call some assistants to help me. Go ahead and put your side rail down. We're going to pull back your sheet. We have this nice draw sheet.
Place a pillow between the patient's knees.
First, we're going to put a pillow between your knees.
Ensure that a lift sheet or draw sheet is under him from his shoulders to his knees. Cross the patient's arms over his chest.
Nice and straight.
With your assistance on the side of the bed to which he will be turned, position yourself on the side of the bed where the pillows will be placed. Fan fold the lift sheet on your side of the bed.
Okay,
While holding the sheet at the patient's waist, have one assistant grasp the lift sheet at his shoulders, and the other grasp it at his thighs.
2.
On the count of 3, roll the patient as a unit in one smooth, continuous motion.
Pillows behind his back.
Place pillows along the length of the patient. As a unit, help your assistants gently lean him back toward the pillows for support. When your patient must be moved into other positions, support him properly. In the SIMS, or semi-prone position, place a pillow under his head, flexed upper arm, and flexed upper leg. Place sandbags or firm pillows parallel to the sole of each foot. In some facilities, you may use specially designed boots or pillows instead of sandbags to maintain proper foot alignment and prevent foot drop. With the patient in the supine position, place a small rolled towel under his lumbar area, a pillow under his shoulders, neck, and head, trochanter rolls or sandbags parallel to his thighs if required, a small pillow under his ankles, pillows under his forearms, and hand rolls in his hands if required. You may also use firm pillows against his soles. With the patient in the prone position, place a small pillow under his head if desired, a small pillow under his abdomen below the level of the rib cage, and, if needed, pillows under his lower legs to elevate his toes. As part of your follow-up care, make sure that the patient is comfortable and check his skin for areas of redness or breakdown. Plan to turn and reposition him at least every 2 hours, or as directed in his care plan. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.